This Good Morning Washington Spotlight on Your Health is sponsored by Regenerative Orthopedics and Sports Medicine. Well, this Wellness Wednesday, we are putting a spotlight on how to get out of pain without surgery. And we have an incredible success story to share for you. I'm joined now by Dr. John Ferrell, co-founder and managing partner at Regenerative Orthopedics and Sports Medicine, and his patient, Wanda Jackson. Wonderful to have both of you here with us on Good Morning Washington. Dr. Ferrell, our viewers very familiar with you, and we're going to get to Wanda's great story in just a moment, but I want to start with regenerative medicine for people that aren't familiar with that.
Yeah, well, thank you for having us. So when we talk about regenerative orthopedics, we're talking about this gap, this treatment gap between patients that are not getting better with conservative care, such as physical therapy, injections, and people that really don't need surgery, right? So these are constantly patients that have small rotator cuff tears, mild to moderate osteoarthritis. It's not bad enough for surgery. They've tried conservative care, they've tried medications, and they still are in pain. And so we can use different things such as platelet-rich plasma. We can use cells from your own fat, from your own bone marrow that can help to turn off inflammation, that can allow you to be more active, have less pain, and get back to a normally functioning life.
Wanda?
Yes.
Before we got on the air, you looked at Dr. Ferrell and said, "This man changed my life. He gave me my life back."
He did.
Tell us how ROSM has changed your life.
Well, before ROSM, I was a runner. I was active, and I was training for the Marine Corps Marathon and doing long running days. Kept having knee problems, and as any athlete would do, kept going forward till I couldn't go anymore. That started a series of just seeing different orthopedics who told me I would never run again, that my knees were that bad. And I fell into a deep depression, actually, put on 80 pounds. And then someone mentioned Dr. Ferrell to me. And I went to Dr. Ferrell, told him what was going on, and told him that every other orthopedic that I had seen told me I needed knee replacement. And he said, "No, you don't. And trust me, trust the process. I can get you back out there." And it's been life-changing. He changed my life.
Well, I think we should point out that 4 orthopedic surgeons said you needed surgery.
Yes.
Look at where you are now and how you are feeling without surgery. What is your message to people living at home with pain? There may be people watching right now that are going in for surgery or have a surgery scheduled. What's your message to them?
Call Dr. Ferrell, call ROSM first and foremost, but don't take my appointments.
She does want to make that clear. You can only call if you're not going to take her appointments.
Don't take my appointments, but find other ways, get second opinions, and explore more regenerative options. And that's something that you don't hear about. Hopefully people are hearing about it today and are willing to just take an exploration, take a chance.
And it doesn't cost you anything to just start that exploration process and start that conversation. So how do people at home start that conversation with you guys and the healing process?
Absolutely. They can definitely reach out to us and go to our website. They can put their information in, and they come in, they'll get an appointment. We take most major insurances. We'll evaluate them. We'll actually take time. Most patient appointments are approximately 30 minutes. So we have enough time to actually listen to the patient, hear what they have to say, and then we do a full exam as well as a musculoskeletal exam and then an ultrasound exam. So the ultrasound allows us to see soft tissues, things like meniscus tears, rotator cuff tears, immediately there in the office. And so if we treat a patient and they get better, we can actually see the healing when we repeat those ultrasounds.
We've been to your offices, many locations here in the DMV, and we've seen you take that time with every patient. That is so important, getting to know the patient. Wanda, thank you so much for coming in and sharing your story. Congratulations on all your success.
Thank you so much.